Common challenges. It's time to look at some of the most common issues that people encounter when changing their diets and nutrition. If you're like most people, you'll run into some difficulties, and it's completely normal. It's not always about a smooth transition. Sometimes it's about testing, learning, and improving. That's how everything works in the universe. So don't take all the marketing hype and transformation stories too seriously. They are showing the top 1% and leaving out 99%. Let's go over the most common issues one by one. 1. First and foremost, fatigue. It is a common side effect when starting a new diet. You may feel exhausted, sluggish, and unmotivated to do anything, and your sleep may suffer as a result. Two prevalent causes for this are easily fixable. Usually, it's either cutting your calorie intake or your carbohydrate intake too quickly. When people begin the transformation process, they are eager to see results as soon as possible. It often leads to dropping calories and carbs too low, which causes the cells of muscles and the nervous system to suffer from energy deficiency. This causes the release of stress hormones, primarily cortisol, which has negative side effects. This usually occurs within the first week of changing one's diet and is fairly easy to identify. What do you do? To begin, increase your carbohydrate intake, along with protein and fat if needed, by 10 to 20 grams per day, or 50 to 100 kilocalories per day, until you feel better. After that, you can experiment more freely with your macronutrient composition. 2. Intestinal problems. These are very common when starting a new diet, especially if your gut is already in bad shape. When starting a new diet, the common intestinal symptoms are bloating, diarrhea, constipation, and sometimes even loss of appetite. One way to treat this problem is to give it time. Rapid and large dietary changes can cause hormonal changes in the intestine, as well as changes in the intestinal microbiota. But this is completely normal and a necessary part of adjusting to something new. The second issue could be too much fiber too quickly. This can result in all of the previously mentioned symptoms. The cure is simple. Reduce the fiber amount or eat only the fiber that your intestine can handle. In some cases, supplementation causes intestinal symptoms, particularly when multiple supplements are started at the same time. In those cases, it is recommended that you stop all supplementation, start them again, one by one, slowly. 3. Dehydration. It becomes a problem, especially when losing weight quickly, changing eating habits, and increasing physical activity. You may experience headaches, dizziness, fatigue, palpitation, and muscle weakness. It's not just how much water you drink, it's also how much you can keep in your cells, tissues, and bloodstream. We won't go deeper into the physiology of this, but it has to do with mineral levels in your body. That's why it is also essential to have an adequate mineral supply in your diet. If you are physically active, sweat a lot, or feel tired or dizzy, you should consider mineral supplementation. 4. Sudden drop in blood sugar and blood pressure. That is a wonderful thing in and of itself, but it may cause complications for people taking blood pressure or diabetes medication. This is why, in those cases, it is critical to monitor both of them more frequently at the start of your transformation process. In such cases, always consult your healthcare professional, preferably before problems arise. There you have the 3 to 4 most common challenges when starting a new diet. If the previous advice does not work for you, or if you have a medical condition, you should see your doctor and possibly have some tests done. Don't be too concerned about problems that arise. This is a completely normal part of any change. The worst thing you might do is start looking for the next trendy diet with the first signs of problems. This time, let's try something different. Follow the plan. Come out of it much stronger.